Okay, so welcome to Mr. K's home. I'm going to be doing the walkthrough tutorial. Here is the front of the house. There is a backyard. It does have a gate there. It's also got steps leading down. There is a second entrance to the home. It's going to be down that way. I will show you that here in a minute when I go inside. So we do have some stepping stones going into the house. There are 3 steps right here, with the top step being the last one, so 2 steps, and then the last no handrails whatsoever. This could be a barrier for my patient because he does need some handrails to go up. Up here we do have a doormat here, and looks like it's a sturdy doormat. It's not going to move, so that's good. We do have another threshold right here going into the house. Probably about 5-6 inches maybe coming into the house. And now whenever we come into the house, we do have lights that go right here. I'm going to close this door. We do have an outside light and an inside light, so that's nice. It is very easily accessible as soon as you get inside. We do have simple locks. We've got a lock here, but we also have a lock here, whichever one would work. Now this is the living room. In the living room, we have a couch, no other furniture besides an ottoman. Looks like the dogs use the ottoman, and it is next to the window with the curtains. We could open these up to improve the lighting inside of the house. We can do that. And so with the couch, it looks like it is, when you sit down, it is about 90 degrees. Modifications would be maybe have him sit close to the edge. That way he can use the side to push up with, or he could even take some pillows or blankets and put underneath him to help with him with standing. It does look like there's a dog toy. This could be a tripping hazard, so we want to make sure that we maybe have a box or somewhere to put all the dog toys so that we do not have any kind of trips. We do have a side table here, good for putting our remotes, controllers, drinks, anything like that on. We do have an outlet here. We have a light here in the living room, and there is another light switch right here that we could use. I would suggest possibly putting a lamp into the living room, or possibly another, like a night light or something to plug in, just because there's only 2 ways to get to the light, and it's here and here. And if he is on the couch with the lights off, or whatever, he might not be able to, if it's late at night and the light, it already gets dark outside, he might not be able to see to stand up. It could cause some barriers there, some safety issues. We do have the TV here, and we do have plenty of walking space. It is a wood floor, which is nice. My concern, there is no rugs here in the house. My concern with the wood floor, though, is that because he does have dogs, 2 big standard poodles, and you can see that there's some mud here around the door, and dirt. So my concern would possibly be that the dogs would have dirt in the floor, and it could be slick. So I would suggest to him to use, to wear some socks, some no-slip socks, or maybe wear shoes in the house while he is up ambulating. I am going to go ahead and show you the second entrance now to the basement. So there is a light switch here that goes to the basement. I cut it on. The door only opens up this far because there is something behind it. This does not look like it's a very wide space right here. So my suggestion would be, I'm going to step here and show you. We do keep, he keeps the dog food here and broom. I would suggest moving the dog food somewhere else, maybe up here where it is more easily accessible to him, so he can open the door all the way up and have more space. Now, as we go into the basement, this is all the lighting that we have here in the basement for now. I do like this. This is a no-slip pad that are on these steps. We do have a handrail, but it is further down, okay? So we have no handrail here for the first maybe 5 or 6 steps. It is a really wide, he would be able to touch going across with his hands if he needed to. I would suggest putting a rail up higher here, having to where he can hold on to something, at least for these first few steps. Now, when we get into the basement, there is another light switch. The light switch is up here, though, so we have to have good balance to be able to do that, on top of, then holding this rail. This rail is a good sturdy rail, so that is nice. Again, it is only on the one side. We do have some clutter in the basement, but it's out of the way and would not affect anything of him needing to come down here and do. We've got a washer and dryer here. It looks like it is a top load washer, and the dryer is down here. I think that should be pretty good for him. He's got plenty of room to stand here. There is no rugs, no nothing to cause any kind of tripping hazard there. And so I'm gonna walk over this way. Now here is a barrier here. Here is a workout mat that could cause some kind of tripping hazard. So be careful with that. Here is the second door. We do have lights again right here, and we have a garage door as well. As for the outside right here, and also we have a trash can right here where he puts his trash. So it is one of those where you have to pop open and stuff, so we need to be really careful with that. Here is the outside of the bottom part of the house where the driveway comes down. My suggestion for my patient would be to have him see if there's any way that maybe somebody in the community or family could put some rails at the top of the driveway, because these gravels are really big and bulky, and it could be really hard, especially with a cane, to ambulate on these. And not only that, but there is more, especially this time of the year, it's wet and slick. These leaves could be really slick. There is a step stone right here. Not only that, but then you have another step going into, on top of having that mat to also step over. So I would suggest going up to the top of the house and parking there, and seeing about getting some handrails put in there. Now I will come back in. Again, easy to lock, should be good, and we do have lights right there. So now I'm going to take you back through the top of the house and show you the rest. I'll show you the bedroom. Now, he does have a bedroom that is a spare bedroom. He does not use it. I'm not going to take you through the room, but I will show you that room here in just a second. I'll show you the outside. This is where he keeps the dogs. Again, there is another step threshold right here. And this is another really good mat, because it's really stuck to the ground. It's not going to move on him or fold up or anything like that. We do have a light for the outside, so that is nice, and there is also a secondary light here. If he were to have to go down these steps, he does not have to go down these steps. This is just the backyard for the dogs. You can see that it is really muddy and gross, so it would not be the best place for him to be ambulating down. So if he doesn't have to, I'm going to suggest him not to. But he does have one handrail on this side. The wood is a little shifty here, so I would just be kind of concerned with getting a splinter with that. No rail on that side, but one rail on the left. And back inside, and again, you can see how that would be a bad place to go with bad weather. So here now we do have the dog and food, water, and good place for it because it is out of the way. Need to make sure that we are easily accessible to the dog and food, water, because those are very important to my patient. Here is the dining room table. Looks like our chairs are good. We have a back to the chair, which I like that. Here at the bar, there is no back to the chair. These do spin, so they go up and down, but my concern is they might be a little too wobbly, and there is no back again. So here is the kitchen. I'm going to go through, show a video here of the kitchen and catch my breath. So with the kitchen, cookware is up here, you know, cups and plates and stuff, and then we have actual pots and pans down here. I want to make sure, I'm glad that this is a pretty big amount of room for him to step and move. I just want to make sure he's got good balance to where he can reach down here and get what he needs. The stove, the controls are on this back part of the stove. So he's got to make sure that he's got that reach to where he can reach that. We do have very good lighting here in the kitchen, which I like, and easy access to the microwave and the sink. Looks like everything's good in the sink. He's got to be able to reach soap, anything else that he might need there. Here is the fridge. I do have a concern with the freezer being this low and pulling it out. It does kind of take a little bit of strength to pull it out. Got to watch there. Here is a closet for the food. I'm not concerned with anything there unless there is stuff down here that he might not be able to reach as well, that he might need to move up to a higher shelf. Now, here is the hallway. The hallway looks good. There is a light right there. I like how his thermostat is also sitting right here, and you can see the numbers on it really well. Here's the hallway. Good. It's a good length. Again, no carpet, nothing like that. We have the bathroom here. I've got a light here. Also have another little light right here, which is great if he needs that. He does have a sink. Everything's covered underneath. We do have a, looks like He does not have any kind of rails and the toilet is low. I would suggest maybe getting some side rails, some safety rails to put up there, and possibly something you pull over the top of the commode in case he needs a higher surface. We do have a walk-in shower here, and it does not have a mat in the shower, so I would suggest maybe getting maybe a shower bench to transfer into the shower, or even also getting like a little sticky for the bottom of the shower. There is nothing here. This could cause him slipping when getting out of the shower. If I were to put a rug here, I would put a really sturdy one that would absorb water. Again, easy access to towels, no concern there. Now I'll take you to his bedroom. Again, my concern is there is only one hall light and it's right there. So if that light is off and he comes out of his bedroom, I would be worried. So I would suggest putting a light here to plug in. Also put a light here in the corner of his room, right here during the night if he has to get up and use the bathroom. So we do have a working smoke detector, and I'm very glad to see that. So now here's his room. So in his room, looks like we've got plenty of room on either side of the bed if he needs to come. It might be a little bit too tight here, so I would actually suggest him staying on this side of the room. He does have a side table if he needs to put anything there. I do have a concern possibly with this gun being here just for safety issues at night. I would suggest putting it in the closet if he would be willing to do that. Closet, little cluttered. I would say let's clean this mess up. Boots might be a little hard to reach up top. I would suggest maybe having a lower shelf somewhere to where we could sit them there and have easier access. Looks like it should be easy access to reach any kind of clothing, but again, this could be very, very bad tripping hazards. I would suggest moving that. But easy access to the light. Again, I would suggest using a night light here. And then here's the spare room. I'm not going to take you through. He does not use this room. Here is the other room. This is the dog's room. Here's the light here, easy access. Here's his two big dogs that he loves very much. And they are in the cage right now, but they're very good. And I want to make sure that they do not jump on him or cause any kind of potential fall hazards. Again, with that dirt is a big concern in this room. Also, you can tell that it's got dirt, so always, specifically make sure I tell him to be careful with this area and make sure that he wears shoes or no slip socks so he does not fall. Thank you very much. Hi, Mr. K. I do have some goals that I want us to work toward in these next 3 days so that we can get you discharged home in a timely manner and to where you will be safe. The first goal, in 3 days, the patient, you, will be able to perform dynamic standing activities independently in order to be able to groom himself upon discharge to his home. Another goal, in 3 days, the patient will be able to ambulate independently with a small-based quad cane in order to be able to walk throughout his home upon discharge. And another goal, in 3 days, the patient will be able to walk up and down 3 steps independently in order to safely walk into his home upon discharge. Now, there are some environmental changes that I looked at and that I've made some considerations for. Some of them would be, one really important one is handrails. I would like for you to have handrails going up on each side of your steps at the top of your house. That's going to be the safest entrance for you. Also, I would like to see some handrails for your basement steps, at least going up just for the first 4 or 5 steps until you can reach that other handrail. And also, very importantly, night lights in your bedroom, hallway, and your living room, especially since you get up during the night a lot to go use the bathroom. This would be really good and would be much safer if you have some kind of light that would come on to where you can see where you're walking. Also, I'd like for you to wear no-slip socks or even shoes because of the flooring and dirt that can get on that floor from your dogs especially and make it really slick. Another thing is your dog food bin. I would like for you to move or help your family let you move that dog food bin maybe into like the kitchen area or where you keep the other dog food or the dog bowls at. That way that basement door can open all the way up if you were to need to go into the basement to wash clothes. And then also that trash can that you have downstairs, if you could also get that moved up and keep that upstairs, maybe even outside the back patio or somewhere close right there. That way it's easier and you don't have to walk down the steps carrying a trash can or trash bag. Also, shower bars or bench for easier access into your shower. That would be nice. And then a no-slip mat for your shower floor so you don't take any chance of falling. Also, if you could do a heavy durable rug in front of your shower, that will keep you from slipping on water when you get out of the shower. And then also some grab bars by your toilet, because your toilet is very low. That would help out really good. And also in your closet, make sure your floor is really clean to where you don't have any clutter and you don't take any chance of slipping on something or falling and having some kind of further complication with that. And you can also consider putting a shoe rack there on maybe off the floor or close, lower to where it's easy to grab your boots and shoes off of there. And I saw that you have a gun sitting beside your bed. It might be safe to just put your gun in the closet. That way at night, if you were to get up out of bed or stumble or anything, just standing up too fast, you don't trip and hit that gun and possibly make it go off. And another thing is dogs. I noticed you've got 2 big dogs. You've got some toys, dog toys in the floor and stuff. So if we could maybe find a certain spot to keep those toys to where they're not just sitting out and you could potentially trip over them. And as for your dogs, I know it's really hard. I prefer to, hopefully they don't jump, but if they do, just keep them outside, especially when you first get home, just to where that you don't take any chance of them jumping on you and pushing you over. Bring them back in, but try to see, it might be worth looking into doing like a dog obedience class to where they'll teach the dogs to not jump on you. And that way you don't have to do that. Some non-environmental factors that are contributing to potential fall risk for you, Mr. K, is that you do have Parkinson's disease. So there are some characteristics that go into that, such as it's very common for patients to have orthostatic hypotension. And what that is whenever you stand up from certain positions, like laying down in the bed, your blood pressure is likely to drop, and that can cause you to be lightheaded or dizzy and then potentially pass out and fall onto the floor. Also, that dyskinesia, where you have the abnormal movements in your body, that could also be a potential fall risk. And even pain, just having pain can be another fall risk factor. Now, a few other things is you do have, take some medicine, that's Cinemet and the Ambien. Both of those can cause dizziness and drowsiness, especially for the Ambien on the drowsiness, even coming into the next morning. So just be really cautious taking those medicines, and just always kind of chart how they make you feel. And then you've got the benign prostatic hyperplasia, which makes you have to use the bathroom a lot during the night. Or even during the day, and that can cause that you to rush to the bathroom really fast. So that's another thing, that moving really fast could also cause you to have a potential fall. And then also, you just had a recent hospitalization for pneumonia, so you are just in general probably a little bit deconditioned still compared to your prior. So that's something else to keep into consideration, because you might you might just maybe be fatigued a little bit more whenever you walk longer distances. So it's nice if you have places to sit, placed around the house, like chairs or something to sit in. That would also help prevent a future fall. Thank you.